Did you know that it is not the day you start your menstruation that your eggs or your ova actually got shed? Do you also know that stopping antibiotics prematurely does not lead to antibiotic resistance? Something I've actually realized among Nigerians, especially those who come to the pharmacy or hospitals and then they tell them, okay, use these antibiotics for this duration of time. Now, what I've noticed is that Nigerians do not finish the antibiotics, and then they will not come back. This thing does not work. It does not do this. It does not work. What did you give me? You prescribed the wrong drug. You prescribed this. You prescribed this. But let me tell you something. Let me let you know something. Now, what we don't know is when you do not complete your antibiotic, especially when they tell you to use at this particular time or this type of duration of time. Okay, when you do not complete it, what happens is it can lead to an incomplete resolution of the infection.
Please, ma, what is so bad about me not finishing my antibiotics?
Okay, antibiotics in general, it's from the name. They actually target bacterial infections. Okay, so not viral infections like cold, not viral infections like catarrh, cough. That some persons just can grab antibiotics. Okay. So like I said, not finishing your antibiotics now, because they target bacterial infections, they could lead to incomplete resolution of the bacterial infections. Okay. What I mean is, it will allow a small portion of the bacteria, which are not yet dead. It will allow the small portion to actually strengthen themselves. They could adapt and they could cause drug resistance. What I mean is, at a point you might not be able to use that same antibiotics, because those bacteria, they suddenly become so resistant to the antibiotics you want to use. So not finishing your drug or not completing it, like I said, leads to incomplete resolution of the infection. Okay. So it leads to you not getting a good result after taking it or when you stop it. So that's just generally it.
Okay. What about if I start getting better after taking the antibiotics the first day, the second day, then I've gotten better? Can I continue using the antibiotics or I should just stop?
Well, not getting better. Even if you get better after like the third day, yeah, after which you'll be prescribed a 5-day course or 5-day antibiotic course for you to use this antibiotics. Now, even if you get better after the third day, it doesn't mean all the bacteria is gone. Okay. I mean, all they are gone. So it doesn't actually mean that. What happens, like I said, some of these bacteria, or just little that they're not yet dead, they actually grow. They will become they will grow and they will become more difficult and more challenging to deal with in the future. That's what happens when you do not take your drug at the right dosage. Okay, when you do not take it at the right dosage, or because you feel better, you feel yes, I can stop. What happens, like I said, the bacteria, they gain strength, they become powerful, they become stronger, they adapt, and then they can lead to, like I said, the drug resistance, whereby the drug will not work on that particular bacteria or that particular infection. Then you now need a stronger antibiotic, which might not be difficult to see, which might be difficult for us to see, even as practitioners. It's difficult for us to see, so that we can prescribe it to you. So generally, it becomes more challenging at the end if you do not finish your antibiotics.
Okay. But does that mean the antibiotics might not kill those bacteria in the future?
In the future, yes, they might not be able to kill. What happens is, when we receive some patients, we ask them to run some tests. Okay. Now, sometimes when we get some of these test results, because we work based on the results, sometimes we see that you find out that, and and an antibiotic which you used 2 years ago, which was able to deal with that your bacterial infection. Sometimes we find after running this test, you won't be able to still use that same antibiotic because it's already resistant to the bacteria is already resistant to that antibiotic.
So that particular antibiotic will no longer work for the infection.
Of course, it will no longer work. And so then we will have to look for an higher antibiotic to be able to deal with it. And if it's not available, it puts us in a difficult position as prescribers. Because then we have to be looking for higher antibiotics at a much higher cost. It might not even be available. There are some drugs you might need to order from abroad just because of your small mistake. So you tend to get these drugs at a higher cost. It might not even be available, and then it becomes difficult also for the patients because you also not get better. Everybody's running a task better for you. So those are the disadvantages and the cons in not finishing your antibiotics.
Okay. And again, can we take our antibiotics as long as possible?
Yes, you should take your antibiotics at the right dosage, as prescribed by your prescriber, or as prescribed by your prescriber.
Okay.
If your prescriber prescribe an antibiotic for like 5 days or 7 days or 2 weeks, take it as much as 2 weeks that it was prescribed to you. Don't self-medicate because the majority of Nigerians, they are involved in that. You see some getting drugs and they'll say yes, they want just one sachet of an antibiotic. Oh, I need one capsule, just cut it.
Of antibiotic
Bisham. And you ask them what they want to use it for. No, they don't even know. They don't even know that they wanted one. So we tend to find out such. So like I said, use it at the right dosage.
Okay.
At the right dosage, as prescribed by your prescriber or your physicians.
Okay, that's good. And what about if I start getting some unexpected side effect of the antibiotics? Can I continue with it or I should stop it?
When you find some undesirable undesirable side effects from antibiotics, take some instance. There are some antibiotics that yes, you get to you might see some side effects like vomiting, nausea, red urine. Yes, and if they are not weakness, there are some that are tolerable. You can make through with those side effects. They don't affect your work, they don't affect you. But the ones that are undesirable is the ones that can affect you. They also affect your work. Maybe you won't be able to, they're not productive. Yes, those ones you can stop it immediately. Or let's assume you having breathing difficulty. Immediately you take this drug, you find that you cannot breathe well. Yes, it's advisable that you stop. Then visit the nearest pharmacy and explain. So they're in the best position to switch or to ask you to stop it while we think of something else. So, but they are the best to actually deal with that. But what you should do is that when you find an undesirable side effect, it's advisable that you stop the antibiotics and report to the nearest pharmacy or hospital.
Okay, thank you, Ruth. So, what do you have to tell us, those of us that have this kind of habit of not finishing our antibiotics? Once we take it the first day, the second day, then we abandon it just because we are getting better. What do you have to tell many of us outside there that have this habit of not finishing their drugs, not even only antibiotics, completing their medication? Yes.
So, yes, what I will advise for those that do not complete the antibiotics or for those that take antibiotics, yes, what I would advise is that try and finish up your medications according to how your prescriber, your pharmacist asks you to. Try and finish it. And in case you miss any dose, take it as soon as you remember. Take it as soon as you remember. Finish your dosage at the right dose. and do not self-medicate. Do not stop just because you feel better. Do not stop just because, oh, I don't like drugs. Do not stop. Always inform your pharmacist when you're about to stop, or if you find anything undesirable, stop and report to your pharmacist. Always be involved with your practitioner or your physician, and do not say actually self-medicate, because it becomes complicated for both parties. It becomes complicated for both the patient, for the pharmacist, for the doctors too. Yes. So always try and finish it up, and everybody will be a better place if we can actually follow this advice.
Okay. Thank you very much, pharmacist Ruth. So I guess you all heard what she said. So make sure you always complete your medication, your antibiotics.